Good morning or afternoon. My name is Stephen Peeler, Executive Director of the IDSA Foundation, and I'd like to welcome you to another webinar in the Dr. John G. Bartlett Education Series from the IDSA Foundation. As a reminder, this is just one of many topics among our complete schedule of Your Health webcasts. All programs are being recorded and will be available on demand for easy access in the future. Thank you for your interest in the IDSA Foundation's Dr. John G. Bartlett Memorial Education Series. We are pleased to offer today's program entitled Seeing the Unseen, HCV in Marginalized Populations, but also wanted to make you aware of another program on a similar topic, Hepatitis C, Elimination in the US and Updated Models of Care. That program will air on July 28th, which is, of course, World Hepatitis Day. To access this or other webinars and education programs throughout the year, please visit the IDSA Foundation's website at www.idsafoundation.org. Please sign up for our monthly newsletter and stay informed of these and other educational events throughout the year. I'd like to now introduce today's guest speaker, Dr. Staci Lockhart. Dr. Staci Lockhart is a PharmD and received her Doctor of Pharmacy degree and postdoctoral training in infectious diseases at the University of Oklahoma. Dr. Lockhart has held the position as Medical Science Liaison within AbbVie's Medical Affairs Virology Division for the past 7 years. Prior to joining AbbVie, Dr. Lockhart was a faculty member at the University of Oklahoma Health Sciences Center, working in infectious diseases with a focus on HIV and HCV. Please join me in welcoming Dr. Staci Lockhart.
Thank you, Stephen, for your kind introduction. On behalf of the IDSA Foundation and AbbVie, we would like to thank you today for joining us for our webinar entitled Seeing the Unseen, HCV Marginalized Patient Populations. Today's webinar will consist of videos that describe 2 patient journeys with HCV and their experience, including the stigma associated with the disease. And then we will follow up with a Q&A session. So as an introduction, May is Hepatitis Awareness Month. This is not only a time to bring awareness to hepatitis C and its impact, and to go over the goals set forth by the World Health Organization for HCV elimination and recognize the work that remains to be done, but it's also a time to better understand the challenges and successes experienced by our patients living with HCV. As a reminder, the World Health Organization set forth HCV elimination goals with a target date of 2030 that consist of 4 pillars. Diagnosing 90% of patients living with HCV, reducing new infections by 80%, treating 80% of eligible patients, and reducing HCV-related mortality by 65%. Although there have been and continue to be many barriers to overcome in order to achieve this goal, we must never lose sight of why we work so diligently in our efforts to achieve this. It's our patients. Patients are at the very center of all we do in our efforts to eliminate HCV. Many remain undiagnosed, untreated, and lack access to care. And furthermore, the majority of newly acquired infections are occurring in younger patients who are using drugs. And with all of this comes stigma, the stigma of HCV. And in order to remove that stigma, it's imperative to understand the patient journey and work collaboratively to get patients to a better place of health and overall well-being. There's no better time than now to recognize patients living with HCV, learn and better understand the experiences and needs from the patient perspective, and celebrate those that have been cured from HCV. So please join us as we hear from 2 patients about their HCV journey.
Tell us how you acquired it, and let's dive into that story a little bit.
Can I be frank about it?
Absolutely.
Okay, so being an IV drug user, has its downfalls, obviously, to it. For the longest time, I would never use a dirty needle, never considered anything of the sort, always even told myself I would never do it. But when that desperation kicks in, or you're just in that moment, you break those rules that you had kind of once set for yourself, and it leads to a path. And in my own head, I remember I had a lot of friends or known people who had it, and I was always sure that would never happen to me. But I can recall only 2 times of ever having shared a needle, and that's how fast it happened. That's all it took, was one of those 2 times.
How old were you when you started using drugs?
Started using, or IV?
Both.
Started using drugs at 19. IV at 21 or 22.
And how did the whole thing begin? Do you recall any specific triggers that
Of how the addiction
started
started?
it? Yeah.
Yeah. I just got my first apartment. I was a young kid. I was 18 or 19, like I said. And I was sleeping on an air mattress in my apartment because I was so broke. That's all I could afford. But I was really happy with it. I'd never tried drugs or anything before this. I was sleeping on an air mattress, and I was also working at a lumber yard at the time. My back was really hurting, and I called in to work for a couple days. This was my first time as an adult, maybe experiencing some kind of like real pain. I went and bought a new bed, like right then and there on my days off. I went and bought a new bed because I thought that was the issue. It didn't go away. So I ended up going to the emergency room, and this was back when opiates or opioids were prescribed a little more frivolously. And I got my first prescription for painkillers.
Where was your head at when they told you that you were positive? What were your first thoughts?
I actually cried. This was my first time where I'd really, it's hard to explain, really set out to get clean, and I was going to do it no matter what it took. I was in detox, and they had brought me the news, and there was like kind of a caseworker that had brought me the news, and I cried because then I realized I didn't know that much about Hep C because it worried me. I didn't know, what treatment looks like. Is there treatment? Or what life would look like after that. I just knew basically how it was contracted, but not what the future for me would look like after that.
So you were worried about treatment and the whole process. Could you get access to treatment, things like that?
Yeah, and what it would do to my body. Really just what the future would look like for that.
What did you know about treatment? Were you afraid of it? Or?
Yeah, the only thing I had ever heard was that treatment can make you sick. I talked to people that were older that had gone through treatment, and they had discussed how ill they became after they took the medicine, and that kind of pushed me away because I never wanted to feel sick. That was the biggest thing for me of trying to get clean, because I could never go long enough without getting sick to get clean. So anything that surrounded me feeling flu-like symptoms or anything like that, I kind of shied away from. So
Right, because a lot of those old side effects mimic withdrawal symptoms from
Correct.
opiates, and yeah, that's a common refrain that we also hear from patients. Talk to me a little bit about stigma. This is still a huge thing around Hep C, and a lot of it's driven, in my opinion, on how the Hep C gets acquired. And the root of it lies in the addiction, but I'm interested in your thoughts about this aspect.
The stigma of the disease or the stigma of addiction?
All of it.
A lot of the reason I never found help, and still sometimes I don't go to doctors or ask anybody for help, is because of that stigma. Just after a few years of kind of proving myself, I feel like that stigma has been lifted just enough to operate. That stigma can really hold you back, and people that get into this line of work, even in your line of work, I feel like, not you guys, but they have that stigma of there's no hope for this person, or we turn out so many of these people, or we see so many people come and go, and you're a flight risk, you don't want help, and people like me had proved that time and time and time again. And it's really, that stigma is really discouraging. And with addiction comes that lack of wanting to ask for help. And then when it comes to ask for help, you don't want to go ask for help because of the way you're talked to, the way you're treated, the way you're dismissed, the way you're not a credible person from the get-go when you tell somebody I'm an addict, especially a doctor. Previously is how I had felt. And that stigma is probably the biggest issue, was one of the biggest issues for me to go get real, genuine help.
So I didn't really want to share my diagnosis with a lot of people because I was afraid that people wouldn't want to be around me and use around me at the time when I was still getting high. So I kind of kept it hush hush, but like I said, I did take the precautions of getting, needles from the needle exchange so that if somebody asked to use my needle, I could just give them a brand new needle. But as far as the stigma goes, even today, sitting here with over 3 years clean, the stigma is still there. I share openly about my past and what I'm doing now and what I'm going to continue to do in my future, because I feel like if more people share about the things that they've gone through, the stigma will not be there as much. But there's always going to be people that judge you.
Yeah, and I think especially around Hep C, a lot of it has to do with how you acquire it.
Right.
And, that's why that stigma still persists as far as the virus now. It really kind of points back toward the addiction part of it. And how did you feel when you first came into the clinic to get evaluated for all this stuff with us?
My first time into the clinic, I had met you once already in the rehab. They wouldn't let me meet with you because we were kind of locked away. I loved it. I loved it ever since. There's really just like a judgment-free kind of feeling, as that might sound kind of cheesy, but like there really is that judgment-free feeling, especially in like that corner of your building where just the people that work there in the atmosphere. And you were the first person I had ever met that like talked to me like a human, I felt like, when I came to them saying that I have a problem.
We hear a lot from patients that when they go to new providers, if they've been referred somewhere to a specialty clinic or something like that, that a lot of times they feel that they're not seen.
Right.
That the stigma of their medical history kind of follows them. Did you ever face that with any of your treatment centers or?
I did at one point. I kind of just felt like a number. When I came to your office to get treatment, though, I definitely felt comfortable and at home, and I always say that because everybody greeted me and they just treated me like I was, an equal up here. So it wasn't really until then that I actually felt that way. At every other outpatient facility I've ever gone to or any clinic, I think a lot of times people look down on us as addicts or as, being treated for Hep C. So I will say that experience was my first experience actually feeling, like I was a part of.
Safe.
Yeah.
So you get through and you find out that you're cured.
Yes.
You hear the words, you're cured.
Yeah.
How'd you feel?
It was awesome. I was really excited, and I got to come and ring the bell.
For the people who don't know, we have a bell, and when patients get cured, they graffiti the walls of the clinic, and we have a cowbell that they ring. And so Lindsay obviously signed and rang the bell and
Yes.
celebrated. It's very emotional whenever somebody does that. It's emotional for all of us.
Right.
Did you feel like you maybe turned a page on something by getting rid of this?
Yes, definitely. Because like my biggest concern was not giving it to anybody else, and the fact that I am a mom. I have 2 children, and I did acquire custody back of them after getting clean. So, you know, I was just nervous of giving it to them. You know, I'm always cleaning everything, you know, they take showers after me and stuff like that. So it was
Kinda
very,
ease your mind.
yeah, it
It's
was
gone.
anxiety ridden. So after ringing the bell and knowing that I was cured, it was like, okay, this is, I can move on to the next chapter in my life. I don't have to worry about this at least, and, you know, push forward. So
Did you feel hopeful when it was over?
definitely, yeah.
Empowered?
Yes, definitely.
So you've come an extraordinarily long way in your life. And, you know, we've heard now from a young age, starting with drugs, to where you are now. Tell us about that. Tell us what you're doing now. 'Cause
So after I was clean for a little over a year, I decided that I wanted to work in the field and help other people with their addiction. So I became a peer advocate, and I've worked at a couple different agencies helping addicts get through, you know, their tough times and trying to help them on their journey to stay clean. I went from one agency to the next agency, and I'm actually about to start working for a different agency. So I've just been basically a resource broker for people with addictions. So I link them with different services to, you know, help them throughout their recovery.
helping people on that journey from
Right.
that you've gone through,
Right.
that you've done.
Right.
It's a very powerful story, right? From how you started to where you are, and it's a story of redemption, I think. You viewed sort of getting the Hep C dealt with is the first step in getting a handle on the addiction.
100%.
Yeah.
Getting your health dealt with in general, and I mean, Hep C obviously was the forefront of my health problems at the time, aside from addiction. What point would there be to move forward, you know, if I had some other kind of monkey on my back that felt
Yeah.
like it was dragging me down physically?
I think that's important for a lot of other patients to hear too, because, you know, in the old days, you had to have a period of sobriety for 6 months before you were eligible
And
for
I'd heard
treatment.
that.
Yeah, and I think yours is a great example where, you know, this paradigm has completely changed. That's no longer the case. So active substance use is no longer a barrier to treatment for the Hep C. And I think your story is an example how quickly getting the Hep C treated, like you said, can serve as a first step to actually deal with the addiction.
Absolutely.
Imagine you're sitting with a kid just like you today, somebody who's in the position that you were in. What's the single most important piece of advice you would give them?
Get real help. Sorry, I'm gonna stumble over this. There's not a lot of advice you can give because of that thing people say, you're not ready to get help until you're like actually willing to get help, or however that statement goes. That's like really true. So like every time can count. So just like keep even if those attempts at getting your life together or getting healthy or, you know, getting over your addiction fail, like that fourth, that fifth, that sixth time, literally just pick your head up every time. You won't get help until you're ready. You won't like really want it. There's something that clicks in your brain that's really just had enough that you're willing to walk 10 miles across town in the snow to go get help. Just keep your head up. I know that's kind of cliche, but really just keep your head up. That's what I did for many years, for about 10 years. Just not giving up, as cheesy as that might sound. That's really the only way to get through it. And once you experience that feeling of such desperate need for help, you'll know it. Something in your mind is different. It's like, you know, I just had my daughter. It's like experiencing that parent love. You know, when a baby's born or something, you'll know the difference in your mind, and really just try to run with that and
Just
work
keep
your butt
trying.
off. Yeah,
Keep trying.
I tried a lot of times, and no one ever thought I would make it out of it. But you just literally have to keep going.
I'm proud of you, man. If you're sitting with someone who's newly diagnosed with Hep C, who's currently in the situation that you were in, what's the single most important piece of advice that you give that individual?
Just hold on, because, you know, I always say, like, hope, hold on, pain ends. because no matter what, you can get through it. So.
Awesome. That's great. Thank you, Lindsay.
Big thank you to our patients for sharing their stories with us today. It's just incredible to hear from them and be able to, hear about their experiences living with HCV and getting an understanding of the challenges that they've had to overcome. But the best part of all of this was just being able to, celebrate their successes despite the challenges that they had. They did end up with being cured, and that's a big success and something to celebrate. And, we hope to be able to celebrate that with many, many more. So as we heard from their stories, and we're all aware of this, again, there are many challenges for our patients living with HCV, and it largely begins with removing the stigma of HCV. As we heard, stigma can impose fear and reluctance in our patients to seek help and engage in care. And as both patients shared, that same stigma can impose a lack of trust and empathy by others, including those in healthcare, that further generates the patient's sense of being unseen. And the good news is from all of this is that we all have the ability to do our part in overcoming the stigma associated with HCV. And as we also heard from our patients, first impressions matter. So in healthcare, when we talk about a patient's willingness to be treated, it's equally important for us to remember as medical professionals is our willingness to treat. So as they both shared, there's a lot of will and determination to seek help. And when we welcome our patients with compassion, and without judgment, this can lead to great success. So thank you again to our patients today for sharing with us, letting us listen to their journeys. And thank you for all of those that have attended with us and listened today. So next, we're going to move on to the Q&A session.
Thank you, Staci. That was wonderful. I think our doctors are going to really appreciate your insight. And I'm sure when we get to the Q&A section, they will have lots of insightful questions for you about that very rich content. Now we would like to open it up to you, the clinician, specialists, and audience. If you have a question for Dr. Staci Lockhart, please type in your question using the Q&A button on your screen, and we will read your question to Dr. Lockhart on your behalf. Again, thank you, Staci, for a wonderful presentation. I'd like to open it up for questions now. So again, just click on the Q&A button at the bottom, and we will read the question for Dr. Lockhart.
So our first question we have today says, the question is, you mentioned additional resources that HCBs can use to better support their patients, and where can we find these types of resources? One of the things that we've developed in medical affairs is called hcv.com. It's a comprehensive website for healthcare professionals, and it allows us to provide education and resources all in one place. So you can learn about the disease itself, through the stages of diagnosis and treatment, and it also provides links to references, additional resources to further support your patient. We've also included our case studies and some of the videos that we heard today from our patients to better understand where patients come from and the challenges that they face when they're living with HCV. And then lastly, on this particular website, we do have patient education resources as well that you can download and print and give to your patients to learn more about the disease itself. All right, so the next question, what can I as a healthcare professional do to address the stigma? Well, as I mentioned, we all play our part, and as we heard from patients, it's going to take all of us to remove the stigma. So, some of the things and from their stories, that they shared, just, removing the stigma and welcoming them into clinic and into care in a non-judgmental capacity. Just treating them as an individual, like we would any other patient that we're treating any other medical condition. So just making them feel like they are in a safe place and that they are able to be themselves and be able to share exactly where they are in their journey. And so we can provide the best care possible. The other thing that we can do is to educate staff members and just everybody working in the clinics and facilities to just help the patients feel welcome and at ease. And again, so we can provide the best patient care and allow them to feel comfortable and being actively engaged in their care and feeling like they can do so. So the next question, other than stigma, what are some other barriers to HCV care? You know, as we heard from our patients, so, you know, stigma is the large part of this, but there are other barriers that we have to think about as well. And part of what we heard through their stories is, you know, one of the things that we can do to help with this is to better educate our patients. You know, they were aware of how they acquired the infection, but beyond that, it was very limited. So it's really important that we, you know, provide education on the disease itself, what can happen to the body, and the fact that they can be treated, that treatments available these days are well tolerated and highly effective. So not what we, you know, historically think of, and changing that mindset. The other thing that we've got to do is provide education to our providers and just making providers aware of their role in eliminating HCV and how we all play a part in this, whether that be from screening and diagnosis, but then also about the disease itself and how they can best educate the patient regardless of where they are in this care cascade. And then, you know, other barriers that we have to overcome are just funding issues. So at a government and payer level, you know, we don't have a lot of promotion and we don't have a lot of funding to support this. So there are many things that, you know, we do have to overcome besides stigma, and we can take an active role in all of these. Okay, so the next question is, what is May Awareness Initiative and how can I help? So the month of May is designated for Hepatitis Awareness Month, and our National Hepatitis Testing Day is on May 19th. And really, this is just part of, you know, just bringing awareness to the disease itself. You know, during the month of May, there are several public entities, including the CDC, that really try to bring light to this disease. You know, oftentimes people are not aware of HCV and the impact that it has. So just trying to, you know, bring forth this type of information and bring awareness to not only patients and providers, but to the general public as well. And really, we just want to, you know, along with this awareness, we want to bring education on how the disease is acquired, education on ways that we can treat people and cure people, and ways that we can prevent infection from spreading. So the next question says, some of the language used in this presentation is stigmatizing by addict and clean. Can you comment on the use and the value of language to address the stigma? So yes, and you know, as we heard, again, I think it goes back to part of the patient's journey and how they explain this and helped us better understand this. It's just how we approach patients, and that includes how we, you know, how we speak and how we engage. And so yes, just trying to minimize some of those terms and just making patients feel more comfortable and at ease, and just making them feel like this is similar to many other diseases and conditions that we take care of in the healthcare setting. So, you know, whether that be diabetes or heart disease or any type of other condition, just making the patient feel comfortable where they are and, you know, not judging and just welcoming and showing compassion and just really trying to figure out how we can help them and how we can partner on this care cascade and their journey into getting them cured. So the next question that we have is, how do you approach hepatitis C treatment in those that are actively drinking large amounts of alcohol? And do you withhold and wait for them to quit? So to answer this, you know, again, as mentioned earlier in these videos, we are not at a place any longer where we have to wait to treat a patient. We can meet a patient where they are for the most part, and there's plenty of data to support treating patients where they are in their journey, regardless if that's drug use or alcohol consumption. So I would say that the majority are still, you know, approaching patients with alcohol consumption, similar to what we are seeing with substance use, and they are going ahead and treating patients. But everybody's a little bit different in their practice. But again, you know, there's no reason from a scientific matter to withhold treatment in patients that are actively using or consuming amounts of alcohol. Okay, so it doesn't look like there's any more questions in the Q&A, but certainly if anybody has any additional questions or comments that they would like to submit, please do so at this time. Wait just a couple more seconds to see if anybody does submit anything. We've got one more. No? Okay, so no more questions. Okay, well, again, thank you for your time today. We really appreciate you joining us to hear about our patients' journey and just not only understanding their challenges that they faced, but celebrating their success. And certainly look forward to the additional upcoming webinars as we bring light to our patients living with hepatitis C. So thank you again for your time today. Thank you again to our patients, and we'll turn it over to Stephen now.
Well, that will conclude today's program, Seeing the Unseen, HCV in Marginalized Populations. I'd like to first of all thank Dr. Staci Lockhart for your great presentation, expertise, and insight in such a relevant topic today. I'd also like to thank the many clinicians and physicians, ID specialists worldwide who had some fantastic questions. I'd also like to let you know that because of generous donors and supporters like you, and because of the partnership that we have with AbbVie, this program was brought to you today in support of the IDSA Foundation. The IDSA Foundation will have this recording posted on its website in the next few days, so please stop back and visit us, and then share the link with a colleague or someone that you know could use it. Thank you again to Staci, all of the attendees, and of course, AbbVie for making this program possible. We look forward to seeing you in July 28th, as we bring you our next educational program. Have a great day.